CNA Exam Prep 2026 Practice Questions Explained. Question 1. Before performing any procedure, a nurse aide must: Option A, identify the patient. Option B, explain the procedure. Option C, wash their hands. Option D, do all of the above. The correct answer is option D, do all of the above. All of the above. Clinical standards require all healthcare professionals to identify the client by checking the ID band or tag before providing care. They should wash their hands both before and after client encounters. They should also explain what they are going to do and give the client an opportunity to ask questions before starting. Question 2. Which of the following statements about blindness are false? Option A. Always identify yourself before touching a blind person. Option B. Diabetes is a significant cause of blindness. Option C. Most legally blind or visually impaired people have no sight at all. Option D. Ask if a blind person needs help before you give assistance. The correct answer is option C. Most legally blind or visually impaired people have no sight at all. Most legally blind or visually impaired people have no sight at all. People who are legally blind or visually impaired may still be able to see, but images can be quite blurry even when they're wearing glasses. Only about 10 to 15% of people who are diagnosed as blind see nothing at all. Question 3. Which of the following measurements that you obtained from Mrs. Shumway should be reported immediately to the charge nurse? Option A, temperature of 99 F. Option B, respiration 20. Option C, pulse 74. Option D, BP 190/114. The correct answer is option D, BP 190/114. BP 190/114. Hypertension is defined as a blood pressure over 140/90. Severe hypertension is above 180/120. Even if the client has a history of high blood pressure, always immediately report a sudden increase to the nurse. Untreated hypertension can lead to heart disease and stroke. Question 4. On which side should the patient lie for an enema? Option A, whichever side is more comfortable. Option B, the side closer to the restroom. Option C, left. Option D, right. The correct answer is option C, left. Left. The left Sims position is used for rectal examinations and administering enemas. The client lies on the left side, with the right knee and hip bent. It is also called the lateral recumbent or semi-prone side position. Question 5. A resident with an ileostomy evacuates feces through the: Option A, ileum. Option B, colon. Option C, jejunum. Option D, anus. The correct answer is option A, ileum. Ileum. The ileum is the lowest part of the small intestine. An ileostomy is an opening in the abdomen that is created during surgery. The end of the ileum is placed outside the body and connected to a bag that collects the waste of the intestine. The ileostomy is usually on the lower right side of the body. Question 6. A nurse aide notices blood in the patient's foretubing. The aide should: Option A, stop the fore. Option B, notify the fore nurse. Option C, try to flush the tubing. Option D, do nothing, that's normal. The correct answer is option B, notify the fore nurse. Notify the fore nurse. When an fore is running well, the tubing should be clear and the foresight clean and dry. If you notice blood in the tubing, notify the nurse. It is beyond the scope of practice for a nurse aide to do anything with an fore. Question 7. Meal trays have arrived. Before serving each tray, the nurse aide should: Option A, check each armband, even on familiar patients. Option B, ask about dietary restrictions. Option C, ask patients if they are hungry. Option D, check the temperature of the food. The correct answer is option A, check each armband, even on familiar patients. Check each armband, even on familiar patients. Some clients have special diets, severe food allergies, or strict fluid restrictions. Before serving a meal tray, always check the client's ID band or tag and match it to the correct tray. Question 8. If the nursing care plan, you note that it is written, O2/N/C at 3L, orthopnea POS, as needed. As a CNA, you know that this means which of the following? Option A, orient the new client at 3 o'clock to the orthopedic unit. Option B, the resident is to be ambulated every 3 hours. Option C, oral care must be performed every 3 hours. Option D, the resident is on oxygen with a nasal cannula on 3 liters. Assist to sit in Fowler's position. The correct answer is option D. The resident is on oxygen with a nasal cannula on 3 liters. Assist to sit in Fowler's position. Resident is on oxygen with a nasal cannula on 3 liters. Assist to sit in Fowler's position. Every facility has a list of approved abbreviations. The CNA should become familiar with these, for reading care plans and for preparing documentation. Question 9. Mrs. Shumway has an order for INO. You have picked up her breakfast and note that she drank half of a 6 ounces glass of juice, 4 ounces of milk, and 8 ounces of coffee. Therefore, you document: Option A, 240 ml. Option B 450 ml. Option C 685 ml. Option D 920 ml. The correct answer is option B, 450 ml. 450 ml. Remember 1 ounce equals 30 ml. Add all the ounces intake and multiply by 30. Question 10. Which of the following are associated with smoking? Option A, pneumonia. Option B, vitamin C deficiency. Option C, heart attacks. Option D, all of the above. The correct answer is option D, all of the above. All of the above. The effects of smoking can cause many diseases and medical complications. Lung cancer, COPD, emphysema, pneumonia, heart disease, heart attacks and strokes, vitamin C and B deficiency. Question 11. A patient who was given insulin in the morning is pale and sweaty and appears confused 2 hours later. It would be helpful to find out whether the patient, option A, had visitors that day. Option B, ate too much sugar. Option C, had breakfast. Option D, has diabetes. The correct answer is option C, had breakfast. Had breakfast. Diabetic clients have a strict schedule regarding insulin injections and eating. Eating causes blood sugar to rise, and the insulin helps move it into the cells. Without food, the blood sugar drops quickly, causing a serious situation. Immediate treatment is necessary. Quickly check the blood sugar level and report it to the nurse. The client will need to eat 15 grams of glucose or a simple carb such as 1/2 cup of orange juice or a tablespoon of sugar. The nurse aide should be aware of which clients are diabetic so that meals are served shortly after the client receive insulin. Question 12. A patient complains that her hand hurts where the 4 is running. The nurse assistant notices that the hand is puffy. The nurse assistant should, option A, reassure the patient that needles always hurt. Option B, put ice on the hand. Option C, notify the medication nurse that the patient is complaining of pain. Option D, notify the 4 nurse that the infusion appears to have infiltrated. The correct answer is option D, notify the 4 nurse that the infusion appears to have infiltrated. Notify the 4 nurse that the infusion appears to have infiltrated. Infiltrating occurs when the 4 fluid leaks into the tissue because of a dislodged or misplaced 4 catheter. The nurse assistant should monitor the 4 site and report if it becomes swollen, cool to the touch or painful. The skin near the 4 site may look pale. Always be careful when moving or assisting a client with N4 to avoid pulling the line. Question 13. When caring for a resident with an indwelling Foley catheter, you should, option A, tuck the tubing under the resident's leg to keep it off the floor. Option B, pin the tubing to the resident's gown. Option C, withhold fluids if the bag is too full. Option D, check the bag and tubing frequently for adequate urinary flow. The correct answer is option D, check the bag and tubing frequently for adequate urinary flow. Check the bag and tubing frequently and for adequate urinary flow. Question 14. You are caring for Mr. Brown, who has a diagnosis of COPD. His SpO2 is 82%. He is currently receiving O2 via nasal cannula at 2 liters/min. What do you do? Option A, turn the O2 to 4 liters/min. Option B, switch the nasal cannula to a mask. Option C, report its stat to the nurse. Option D, ask Mr. Brown to take breaths more frequently. The correct answer is option C, report its stat to the nurse. Report its stat to the nurse. The normal SpO2 range for a client with COPD is 88 to 92%. This is because oxygen reaches the lungs but lung damage prevents oxygen from getting into the blood. For clients with COPD, giving oxygen is carefully regulated with limits according to how the oxygen is delivered. Immediately report a low saturation to the nurse. Do not make any changes on your own. Question 15. Mrs. Hernandez had a hip replacement and is admitted to the long-term care facility for rehabilitation. Her condition is considered, option A, chronic, option B, tonic, option C, acute, option D, obstetric. The correct answer is option C, acute. Acute. An acute event is a new or sudden situation that is expected to resolve. Examples are a broken bone, head cold or flu, or an asthma attack. Question 16. To take a rectal temperature, a nurse aide should insert the thermometer and, option A, stay in the room until it is time to read the temp. Option B, hold on to the thermometer until it can be removed. Option C, take care of other patients, returning in 3 minutes. Option D, go on a break. The correct answer is option B, hold on to the thermometer until it can be removed. Hold on to the thermometer until it can be removed. A rectal reading is the most accurate but needs to be done correctly. After placing the client in Sims position, lubricate the thermometer and insert it about 1 to 2 inches into the rectum. Hold the thermometer in place for 2 minutes to prevent it from being pushed out or advancing into the rectum. Question 17. Drainage bags from urinary catheters should always, option A, be changed every shift. Option B, be kept below the level of the bladder. Option C, be fastened securely to the bed frame. Option D. Have their output measured each week. The correct answer is option B. Be kept below the level of the bladder. Be kept below the level of the bladder. Drainage bags from an indwelling Foley catheter should be kept below the level of the bladder to prevent urine from backflowing into the bladder. It also allows gravity to help drain the tubing. Question 18. The charge nurse has asked you to take Mrs. Shumway's vital signs. Before doing so, you must: Option A. Wash your hands. Option B. Gather all appropriate equipment. Option C. Identify the patient and introduce yourself. Option D. All the above. The correct answer is option D. All the above. All the above. Before providing care, the nurse aide must perform all the standard steps in preparation, including gathering everything you need, washing your hands, knocking and introducing yourself, identifying the client and explaining what you will be doing in their care. Question 19. A hospice specializes in the care of people who are: Option A. Chronically ill. Option B. Terminally ill. Option C. On Medicare. Option D. On Medicaid. The correct answer is option B. Terminally ill. Terminally ill. Hospice care is specialized care for clients who are terminally ill. The care includes the family and caregivers. It does not attempt to cure the client but to improve the quality of life for everyone involved. Question 20. When dry, hard stool fills the rectum and will not pass, it is called: Option A. Impaction. Option B. Edema. Option C. Incontinence. Option D. Atrophy. The correct answer is option A. Impaction. Impaction. Fecal impact ions commonly occur in people who suffer with chronic constipation. A fecal impaction is a mass of dry, hard stool in the colon or rectum. The client is unable to pass without assistance. Stool may need to be removed manually by inserting a gloved finger into the rectum. Enemas and laxatives may also be tried. Question 21. Strokes are seen in the elderly. A stroke occurs when: Option A. The heart fails. Option B. The brain is deprived of oxygen. Option C. The muscles die. Option D. The lungs fill with fluid. The correct answer is option B. The brain is deprived of oxygen. The brain is deprived of oxygen. A stroke occurs when the blood supply to the brain is cut off, so oxygen cannot reach the brain cells. Strokes are caused by blood clots in the arteries of the brain or a burst blood vessel in the brain. Question 22. Which of the following is a major reason for urinary incontinence in the elderly? Option A. The muscle that keeps the urine in the bladder weakens. Option B. They are too lazy to go to the bathroom. Option C. They can't tell when they need to urinate. Option D. Their circulatory system is failing. The correct answer is option A. The muscle that keeps the urine in the bladder weakens. The muscle that keeps urine in the bladder weakens. As part of the aging process, clients may experience incontinence due to weakness of the muscle that keeps the urine in until the client can go to the toilet. Another reason is that the bladder itself doesn't contract to expel urine. Bladder infections and prostate problems can also contribute. Alzheimer's or multiple sclerosis can also be causes. Question 23. Various factors will change pulse rate. Increased pulse rate can be caused by: Option A. Coma. Option B. Depression. Option C. Sleep. Option D. Exercise. The correct answer is option D. Exercise. Exercise. The heart rate is lowest when the person is at rest or not engaging in physical activity. The heart rate increases when there is a need for more oxygen. Exercise always triggers a faster pulse. Other factors that raise heart rate could be pain, anxiety, stress, or too much thyroid medication. Question 24. Diabetes mellitus makes a resident more prone to develop: Option A. Cancer. Option B. Chills. Option C. Fever. Option D. Infections. The correct answer is option D. Infections. Infections. Diabetics have high blood sugar levels, which can weaken the body's immune system. In diabetes, infections most commonly occur in the urinary tract and skin. Diabetics often have nerve damage. They can develop foot infections without realizing it. Question 25. When lifting a heavy object, which muscle groups should you use? Option A. Muscles of the back. Option B. Muscles of the hand. Option C. Muscles of the shoulder. Option D. Muscles of the legs. The correct answer is option D. Muscles of the legs. Muscles of the legs. When lifting a client or heavy object, use your legs to position yourself to support the load. Keep your back straight and locked. Do not turn or twist. Bend your hips and knees to squat down. Keep the load close to your body and straighten your legs as you lift. Question 26. What can the nurse aide give a resident who has an order for NPO? Option A. Unlimited fluids. Option B. Small amounts of ice. Option C. Only clear liquids. Option D. No food or liquids. The correct answer is option D. No food or liquids. No food or liquids. NPO is a common medical term that means the client cannot eat or drink anything, including water or ice chips. A doctor may order NPO before surgery or certain lab work. If a client is ill or has a gastrointestinal condition, the doctor may write an order to be NPO until the cause is known. The nurse aide can provide mouth care for a client who is NPO. Question 27. Constipation and indigestion can result from Option A, slowed peristalsis, Option B, slowed metal response, Option C, slowed brain waves, Option D, slowed respiration. The correct answer is Option A, slowed peristalsis. Slowed peristalsis. About 75% of elderly people have slowed peristalsis, muscular contractions that move food through the intestines, because there are fewer nerves to control the gut. As a result, food does not move in an even pattern, causing constipation and indigestion. Question 28. A nurse aide is going to take Mr. Heath's vital signs. What should the nurse aide do to reduce Mr. Heath's anxiety and get him to cooperate? Option A, explain the procedures to Mr. Heath. Option B, wear disposable gloves for all procedures. Option C, gather all needed equipment before beginning. Option D, wash your hands before and after. The correct answer is Option A, explain the procedures to Mr. Heath. Explain the procedures. Before providing any care, the nurse aide must follow all the standard steps in preparation. Gather everything needed, wash hands before and after interactions, and always confirm client's ID. Explain the procedures to the client, even for routine tasks. Allow the client to ask questions before proceeding. Question 29. Elderly residents sometimes appear stooped over and seem to have lost height. This is due to Option A, decreased cardiac output. Option B, the resident's increased difficulty breathing. Option C, the deterioration of muscle tissue. Option D, osteoporosis in the spinal column. The correct answer is Option D, osteoporosis in the spinal column. Osteoporosis in the spinal column. Osteoporosis in the spinal column can lead to a gradual loss of height and stooped posture. The loss of calcium in the vertebrae of the spine can cause fractures and back pain, although most are tiny and painless. Can occur in both older men and women. Question 30. The nurse aide notices on the flow sheet that a resident has not had a bowel movement for 5 days. The nurse aide should Option A, report this to the charge nurse. Option B, wait to see if she uses the bathroom tomorrow. Option C, ask the resident's roommate if she saw the resident use the bathroom. Option D, ask the other nurse aides if the resident had a bowel movement that wasn't recorded. The correct answer is Option A, report this to the charge nurse. Report this to the charge nurse. Although each person has a unique pattern of bowel movements, the normal number is 3 to 14 times a week. If the client has had a sudden change in bowel habits or is experiencing bloating, pain or nausea, the cause should be investigated. Adding fiber and fluids to the diet can help prevent constipation. Question 31. Which of the following is true regarding the use of side rails on a bed? Option A, side rails on one side of a bed should be raised at all times. Option B, side rails should be raised at night. Option C, side rails should be raised on both sides when making an occupied bed. Option D, side rails should not be raised unless stated in the care plan. The correct answer is Option D, side rails should not be raised unless stated in the care plan. Side rails should not be raised unless stated in the care plan. Bed rails can be a safety risk for some clients, who might be injured while trying to get out of bed. Clients can also become trapped or strangled in bed rails. Using bed rails without permission can be seen as an attempt to restrain the client. Always follow the care plan regarding use of the bed rails. Question 32. The plan that starts on the resident's admission and assists when the resident goes home is called Option A, the nurse aide flow record. Option B, the nursing care plan. Option C, the discharge plan. Option D, the treatment plan. The correct answer is Option C, the discharge plan. The discharge plan. A good discharge plan allows for continuity of the care that begins on admission. It anticipates possible issues or barriers that the client or the client's family may encounter, and services that will be needed after discharge. All team members can contribute to the plan, based on their interactions with the client. Question 33. The loss of the ability to express oneself is known as Option A, verbal communication. Option B, aphasia. Option C, speech therapy. Option D, empathy. The correct answer is Option B, aphasia. Aphasia. When a client has suffered a stroke or some other head injury, the speech center of the brain can be damaged, resulting in aphasia. Chief signs of aphasia include difficulty finding appropriate words when speaking, trouble understanding speech, and difficulty with reading and writing. Question 34. There are 2 kinds of restraints. Option A, chemical and physical. Option B, masks and goggles. Option C, chemical and medication. Option D, belts and wristbands. The correct answer is Option A, chemical and physical. Physical and chemical. There are 2 categories of restraints. Physical restraints are devices that are designed to restrict movement like vests, belts, hand mitts or bed rails. chemical or medications to control behavior such as yelling or combative behavior. All restraints require a physician's order. Question 35. Wasting or a decrease in the size of a muscle is called option A, edema, option B, decubitus, option C, atrophy, option D, impaction. The correct answer is option C, atrophy. Atrophy. Muscle atrophy is a loss of muscle mass. The main cause is lack of physical activity, which may be due to injury or disease. After injury, the muscles are often immobile or painful to move. Diseases which lead to atrophy include multiple sclerosis, anorexia, and AIDS. Question 36. A resident is NPO for tests. The nurse aide should option A, allow the resident to eat ice chips, option B, encourage fluids for hydration, option C, allow the resident to drink water only, option D, remove the water pitcher and glass from the room. The correct answer is option D, remove the water pitcher and glass from the room. Remove the water pitcher and glass from the room. NPO is a common medical term that means the client cannot eat or drink anything, including water or ice chips. A doctor may order NPO before surgery or certain lab work. The nurse aide can provide mouth care for an NPO patient. Question 37. When lifting, the nurse aide should have their feet separated in the standing position to option A, provide a wide base of support, option B, to prevent straining the knees, option C, relieve the pressure on the toes, option D, distribute body weight evenly. The correct answer is option A, provide a wide base of support. Provide a wide base of support. When feet are placed shoulder width apart, a comfortable and wide base of support is established. With a wide base, you are less likely to lose your balance. Question 38. Who supervises the work of a nurse aide? Option A, a nurse, option B, the office manager, option C, a social worker, option D, the resident's family. The correct answer is option A, a nurse. A nurse. The work of a nurse aide is overseen by a RN or a LPN/LVN. The scope of practice of the RN/LPN includes having responsibility for staff who provide daily, hands-on care for clients. Open communication makes for excellent care. Question 39. A diabetic resident asks the nurse aide to cut her toenails. The nurse aide should option A, do it because it is part of the job, option B, tell the resident okay, but they will have to soak their feet first, option C, tell the resident that the nurse aide cannot do it but will report it to the charge nurse, option D, ask another nurse aide to help. The correct answer is option C, tell the resident that the nurse aide cannot do it but will report it to the charge nurse. Tell the resident that the CNA cannot do it but will report it to the nurse. Diabetics often have neuropathy and may be unable to tell if their feet are injured. Even trimming toenails can cause an injury. Diabetics need expert care from a podiatrist or a qualified foot care professional. You can be held liable if the client develops an infection after you cut her toenails. Question 40. A hepatitis B vaccination protects the person receiving it against a disease that affects option A, the skin, option B, the kidneys, option C, the liver, option D, the heart. The correct answer is option C, the liver. The liver. Hep B is a serious, contagious infection caused by the Hep B virus, HBV. Most commonly spread by exposure to body fluids, it can cause both acute and chronic disease. Many agencies and facilities require employees to receive the HBV series. Question 41. All of the following statements about type 2 diabetes are true except option A, type 2 diabetes is very rare in adults, option B, it is associated with being overweight or obese, option C, type 2 diabetes may require medications or insulin, option D, it can be controlled with diet and exercise. The correct answer is option A, type 2 diabetes is very rare in adults. Type 2 diabetes is very rare in adults. More than 34 million Americans have type 2 diabetes, usually occurring in adults over 45 who are obese and inactive. It is a chronic disease that requires ongoing medical management. There is no cure, but it can be controlled with lifestyle changes like diet and exercise. Medications or insulin can be helpful in managing blood sugar levels. Question 42. A Foley catheter is used, option A, as a rectal tube, option B, to suction stomach contents, option C, to drain urine from the bladder, option D, for gastric feeding. The correct answer is option C, to drain urine from the bladder. To drain urine from the bladder. A Foley catheter is a sterile tube that is placed into the bladder to drain urine. It is held in place by a balloon that is inflated after being inserted. You should check that the tubing is open so that the urine can flow from the bladder. After each position change or whenever the client returns to the bed or chair after being up, ensure that the tubing is not kinked or closed and the bag is lower than the bladder to prevent backflow. Question 43. What is the purpose of the chain of command in a long-term care facility? Option A, to keep communication about a problem flowing smoothly. Option B, to be sure that residents follow the rules. Option C, to prevent residents from going behind the nurse's station. Option D, to provide more jobs in nursing. The correct answer is option A, to keep communication about a problem flowing smoothly. To keep communication about a problem flowing smoothly, every staff member has a role in providing excellent client care. With good communication, each person can work within their scope of practice and allow others with different authority to handle the appropriate tasks. Question 44. To count respirations, one respiration includes: Option A, 1 inhalation. Option B, 1 exhalation. Option C, 1 inhalation and 1 exhalation. Option D, 1 inhalation and 2 exhalations. The correct answer is option C, 1 inhalation and 1 exhalation. 1 inhalation and 1 exhalation. The normal respiratory rate for adults is 12 to 18 breaths per minute. To get an accurate respiratory rate, choose a time when the client is resting. Observe the client for 1 minute while counting. Each rise and fall of the chest represents 1 respiration. While counting, note if the client is having trouble breathing or taking full inhalations. If so, notify the nurse. Question 45. The nurse aide knows to wear which of the following when performing care for clients? Option A, shoes with non-skid soles. Option B, name badge with job title. Option C, clean uniform or scrubs. Option D, all of the above. The correct answer is option D, all of the above. All of the above. The nurse aide is considered a healthcare professional and should dress accordingly. Each facility has a dress code policy regarding the type of uniform to wear. Shoes must be closed-toe and non-skid soles. Question 46. Why should heat not be applied to a diabetic resident's feet? Option A, their feet might be dirty. Option B, it makes diabetics' feet wrinkle. Option C, diabetics have decreased sensitivity to heat. Option D, the feet have more oil glands. The correct answer is option C, diabetics have decreased sensitivity to heat. Diabetics have decreased sensitivity to heat. Diabetics often have neuropathy and may be unable to detect if their feet are injured and detect temperatures. Diabetics should always wear socks and shoes to prevent cuts or injuries to their feet. Question 47. Many elderly residents lose their appetite because of: Option A, social isolation. Option B, decrease in number of taste buds. Option C, depression. Option D, any of the above. The correct answer is option D, any of the above. Any of the above. As people age, loss of appetite can be normal, but there are also specific reasons that the ability to enjoy food declines. All listed can be causes. Other causes include dental problems and side effects of medications. Question 48. The best way for a nurse aide to gather information about the safety and well-being of a resident is: Option A, observation. Option B, to listen to the nurses talk in the medroom. Option C, to listen to other nurse aides during the break. Option D, flow sheets. The correct answer is option A, observation. Observation. As the primary staff member providing hands-on care for a resident, the nurse aide is able to observe the resident's current condition accurately. Flow sheets provide information about the resident over time, but the nurse aide is able to assess the situation in real time. Question 49. For most residents, the range of normal respiration is: Option A, 28 to 30 inspiration/minute. Option B, 12 to 20 inspiration/minute. Option C, 8 to 16 inspiration/minute. Option D, 20 to 28 inspiration/minute. The correct answer is option B, 12 to 20 inspiration/minute. 12 to 20 inspiration/minute. The normal breath rate for adults is 12 to 20 times/minute. Question 50. Which of the following is a proper way to correct an error in charting? Option A, use correction fluid. Option B, scribble it out with several lines. Option C, draw a single line through it. Option D, erase it completely. The correct answer is option C, draw a single line through it. Draw a single line through it. There are strict guidelines on how to correct a charting error. Never erase or cover the error. Draw a single line through so that the entry is still visible. Add the date and your initials. Continue with the correct entry. There can be serious consequences for you and your facility if proper protocols are not followed. Question 51. Headaches, nausea, and pain are considered: Option A, observations. Option B, symptoms. Option C, assessment. Option D, charting. The correct answer is option B, symptoms. Symptoms. Symptoms are the client's experience of how they feel pain. Things only the client can perceive and report. They may contribute to signs that are observable, but the symptoms begin with the client. Question 52. Signs of poor circulation include: Option A, hot flashes. Option B, paleness, cold skin, and edema. Option C, perspiration and red skin. Option D, warm, dry, pink skin. The correct answer is option B, paleness, cold skin, and edema. Paleness, cold skin, and edema. Poor circulation is the result of another medical condition, peripheral artery disease, PAD, is a narrowing of the blood vessels in the arms, legs, head or stomach resulting in impaired blood circulation. Without a good blood supply, the skin becomes cool and pale. Edema develops when extra fluid cannot be returned to the heart. Other symptoms include numbness, tingling, pain or cramps. Other causes of poor circulation are diabetes, obesity and varicose veins. Question 53. If the resident is smoking and the nurse aide needs to take an oral temperature, what should the nurse aide do? Option A, tell the next shift to take the temp. Option B, brush the resident's teeth first. Option C, take a rectal temp. Option D, wait 15 minutes to take the temp. The correct answer is option D, wait 15 minutes to take the temp. Wait 15 minutes to take the temp. Before taking an oral temp, determine if the client has smoked or had anything hot/cold to drink in the last 15 minutes. If so, wait a full 15 minutes before taking the temp to obtain an accurate measurement. Question 54. A nurse aide is assigned to a stroke patient with a diagnosis of aphasia. Option A, the nurse aide knows that the resident cannot walk. Option B, the resident cannot swallow. Option C, the resident cannot talk. Option D, none of the above are true. The correct answer is option C, the resident cannot talk. The resident cannot talk. When a client has suffered a stroke or other head injury, the speech center of the brain can be damaged, resulting in aphasia. Chief signs are difficulty finding appropriate words when speaking, trouble understanding speech and difficulty with reading and writing. Question 55. A sitting or semi-sitting position with the head of the bed elevated is called option A, Fowler's, option B, prone, option C, supine, option D, lateral. The correct answer is option A, Fowler's. Fowler's position is the standard way to position a client to improve oxygenation. There are several types of Fowler's. High Fowler's, 90-degree angle to allow the chest to expand. Semi-Fowler's, 45 to 60-degree angle for drainage and comfort. Question 56. The exchange of oxygen and carbon dioxide takes place. Option A, around the kidneys. Option B, in the lungs. Option C, in the intestines. Option D, in the heart. The correct answer is option B, in the lungs. In the lungs. The lungs are the main organs of the respiratory system. They take in oxygen during inhalation and release carbon during exhalation. These gases are exchanged in the tiny air sacs of the lungs, called alveoli. Question 57. A bedsore or decubitus ulcer is caused by option A, burns, option B, fatigue, option C, inadequate turning, option D, abrasions. The correct answer is option C, inadequate turning. Inadequate turning. One of the primary responsibilities of the nurse aide is to monitor the client's skin for any signs of breakdown that could lead to bedsores. During baths, dressing, or positron changes, inspect the skin for redness, pallor, warmth, or bruising. Reposition at least every 2 hours, protecting areas that rub together. Massages to the back and buttocks can promote circulation. ROM exercises are also helpful. Always report any sign of skin breakdown to the nurse. Question 58. The thinning of the fatty layer under the skin could cause a resident to option A, lose his or her appetite. Option B, have difficulty walking. Option C, develop pressure sores. Option D, have slowed mental responses. The correct answer is option C, develop pressure sores. Develop pressure sores. The outer layer of skin becomes thin and appears pale and clear. Blood vessels become fragile, leading to bruising and bleeding under the skin. The fat layer also thins, so there is less padding, increasing the risk of injury or pressure sores. Rubbing or pulling on the skin can produce skin tears. Question 59. The goal of the healthcare team is to option A, obtain reimbursement. Option B, provide quality care. Option C, assign tasks and responsibilities. Option D, provide case management. The correct answer is option B, provide quality care. Provide quality care. Healthcare teams are based on the idea that no one has all the knowledge to do everything for a patient. By having each specialty contribute, the patient gets the best possible care. Question 60. Which is incorrect when you're recording on a patient's chart? Option A, your handwriting must be legible. Option B, record only what you observed and did yourself. Option C, record in a logical manner. Option D, use a pencil in case you make a mistake. The correct answer is option D, use a pencil in case you make a mistake. Use a pencil in case you make a mistake. All documentation must be done in permanent ink. If you make a mistake, follow your facility's policy on correction. Usually a single line through the error, along with the date, time, and your initials. Question 61. Who is responsible for the entire nursing staff and the activities involved in providing safe care? Option A, a registered nurse. Option B, the supervisor. Option C, the case manager. Option D, the director of nursing. The correct answer is option D, the director of nursing. The director of nursing. The DON is a registered nurse who oversees all patient care at a facility. They supervise all nursing staff, manage budgets, and handles patient and family issues that staff RNs can't resolve. Question 62. A healthcare agency or program for patients who are dying is: option A, a preferred provider organization, option B, managed care, option C, hospice, option D, case management. The correct answer is option C, hospice. Hospice. Hospice is a special type of care for patients with life-limiting conditions, their families and their caregivers. The goal is to maintain the patient's dignity and quality of life, while supporting each person. Question 63. The RN assigns you a task that is in your job description. Which of the following statements is false? Option A. The RN should give you clear directions before you perform the task. Option B. The RN can delegate the task to you if it's suitable for the patient. Option C. The RN should delegate every non-RN task to you. Option D. The RN should check that you have the necessary education and training. The correct answer is option C. The RN should delegate every non-RN task to you. The RN should delegate every non-RN task to you. Although the RN can assign or delegate tasks that are in your job description, they should ensure you know how to do the task and that it's beneficial to the patient. Some non-RN tasks may be outside of the scope of your CNA practice. If so, inform the RN.